Welcome to World Medical Relief,
where our mission is to facilitate the distribution of surplus medical resources
where they're needed.
Goods are distributed in a non-discriminatory manner,
without regards to race, color, gender, religion, nationality, or political beliefs.
As a volunteer, you're an integral part of this organization. This video is meant to give you a brief introduction to some of the medical supplies you can come across while sorting.
If you have any questions on the floor, feel free to ask Sherry, Jackie, Elsie, Dr. Sampson, or any of the United Heal volunteers.
Before you begin sorting, make sure your hands are clean and you are wearing gloves. We have both latex and non-latex gloves.
Sorting is split into two categories, macro and micro. Macro sorting deals with more general categories, whereas in micro sorting, supplies are sorted in more specific categories, often based on the nature of the item itself.
All the supplies we have to have an expiration date 6 months out from the current date or later. For more information, check this sign right here for the exact date you need it to be after. If the item is expired, like this one right here, put it in a cardboard box underneath the table, like this one. Don't put trash in there. Trash, like this, packing material like cardboard, goes in containers like this.
The liquids cart is located near the entrance to the sorting floor. Place any fluid in here and make sure the container is unopened. The expiration date does not matter for liquid. There are a few other carts here, including ostomy and lab, which includes any lab work or blood tests, and often come in small little vials like these.
Between the macro section and the micro section, you'll find these aisles. If you have any supplies that expire 2 years out from the current year, they go on these aisles. Please sort them into the general categories: surgery, anesthesia, respiratory, all the way down to patient care.
The needles and syringes section is very self-explanatory. All syringes and needles besides insulin needles go into this category. Place all syringes and needles into a cardboard box like this. Do not attempt to sort this box into any of the blue plastic boxes unless instructed to do so.
If you find a suture, place it in the suture area, which is a sorting shelf near the warehouse manager's office. If you can't find it, ask for help.
The IV category involves supplies that administer fluids from the external environment into the blood. They include things like initiation sets and butterfly needles.
Any supplies that we use to prep an operating room or to clean a patient post-surgery would go in the surgery category. These include such things as gowns, drapes, gauze pads, gloves. Pay special attention to whether the item is sterile or non-sterile, and whether it's contained in its original and sealed packaging.
The anesthesia and respiratory section includes supplies such as oxygen masks, tracheostomy tubes, and other large tubing. Check for words such as trach, breathing, or respiratory. These tubes are often ribbed and larger than the width of your finger.
All splints, braces, slings, and other injury support supplies go in the orthopedics category.
If you see anything that either pertains to irrigation or drainage, or to collecting, it goes in this category.
The patient care aisle is everything from hygiene to general doctor's office supplies. You'll find items such as soaps, clothing, swabs, or powder formula.
The urology and nutrition category include things like catheters and nutrition kits. If something in the item description includes something about urine, UR, or the bladder, it goes in this category. If an item requires electricity or specific machinery, place it in one of the blue technology bins in the micro sorting room. This includes electrodes and cauterizers. If you have any additional questions while sorting, please feel free to ask one of the World Medical Relief full-time staff members or one of the United to Heal team leader volunteers, and we will be happy to help you with your question. Thank you so much for giving us your time today,